This is Healthcare Now Radio's Interviews Now. Thanks for listening in. I'm Carol Flagg, your host for today's episode. You can follow our show at hashtag InterviewsNOW and join the conversation and follow Healthcare Now Radio at HC Now Radio. In this fast-paced, ever-changing landscape we call healthcare delivery, who can we trust to tell us the good, the bad, or what's happening now? We're here to help you sort out these issues with thought leaders in the know. On this episode, we talk with Timothy Mills, the Chief Growth Officer for Alpha 2. Our conversation today will focus on provider reimbursement and specifically on the MIPS program. Tim, thanks so much for taking time out today to chat with us.
Sure, thank you. It's a privilege to be here.
Before we begin, can you tell our audience about yourself, a little bit about you, your background, how you ended up in healthcare and at Alpha 2?
Sure, happy to. Yeah, I like to stop counting at 25 years, but I've actually been in this crazy health reimbursement market for, I guess, about 30 years now. And while I started out really in the delivery and software development, I really began my healthcare IT career providing claims adjudication solutions to the large payers and health insurance marketplace. So kind of launching really into the healthcare market really through the lens of the payer side of the reimbursement and really having an appreciation for just all the change that really begins on the payer and insurance side. The second part, I kind of put these in four buckets. So the second part of my background was really transitioning into more of the providing HIT solutions to the hospitals and health systems marketplace, primarily focused on the exchange of healthcare data, clinical, financial, administrative data, kind of the early Community Health Information Network, what you'd call HIE, Health Information Exchange markets now. Third bucket was actually providing outsourced services, so transcription, dictation, coding services, even outsourced billing and revenue cycle management services directly to both ambulatory practices as well as acute care facilities. So really leads me to kind of the fourth bucket. I was introduced to Alpha 2 just a couple of years ago, and it really is a privilege to join the senior management team there. And as you'll see, Alpha 2 kind of delivers solutions that virtually cover all aspects of what I've been focused on for the past 30 years. So it was a natural transition, and really excited to be here at Alpha 2.
Yeah, I'm just thinking as you were going over all of that, the amount of change you've seen in the last few decades in this reimbursement and RCM space, it's so these enormous shifts.
Yes, no doubt about it. I mean, clearly the one constant in healthcare reimbursement is change.
Yeah. Would you just curious, is this transition that we're in the midst of from fee-for-service to value-based care, that I would think in the last few decades certainly has to be, if not the biggest seismic shifts in healthcare from this perspective, if not the biggest.
Sure, no doubt about it. And, certainly I think it's a welcome to change. I mean, certainly most clinicians went to medical school to be focused on patient outcomes. So now that we're beginning to see the reimbursement model shift from volume to value, I think really matches what both clinicians want, what payers want, and ultimately what patients want, which is to focus on outcomes and to focus and ensure that we're rewarding clinicians to do what they want to do in the first place, which is optimal, outcomes.
Yeah. Well, let's shift our focus of our conversation then to the heart of what we're here to talk about today, which is MACRA and MIPS. Obviously, this is a huge focus right now in the industry for providers reporting under MACRA and the MIPS program, as well as the APM program. But there still seems to be a good bit of confusion around the quality payment programs within the industry itself. What do healthcare providers need to know about MACRA and MIPS as they look to maximize their reimbursements in 2018? What are you talking to with your clients about this?
Sure, that's a great question. I think certainly part of it is really just understanding that what Health and Human Services has done here with really taking, that MACRA, which was the legislation, the Medicare Access and CHIP authorization legislation, and converting this to the quality payment program. There were, multiple different programs that were already in place. PQRS, which was brought about in 2007, Physician Quality Reporting System, Meaningful Use, which has been around for a number of years, and the value-based modifier. These were separate programs So I actually am encouraged that HHS, through this macro legislation, chose to create a single program with the quality payment program to really combine these three previous programs into one. And certainly the two tracks, you mentioned the advanced alternative payment models, APMs, which is primarily focused on that accountable care marketplace. Mm-hmm. But the vast majority of clinicians, are focused on the merit-based payment system and really, understanding that this really is a natural transition, that continued transition of healthcare reimbursement from fee-for-service to value-based care, that move from volume to value. It really helps, I think, to put a better perspective on that. The reality that this move introduces, new programs and mechanisms that really help to put a frame around, the focus on quality, the focus on, what was called advancing care information, which replaced meaningful use and now promoting interoperability. This brand new category called improvement activities, there was some confusion in the marketplace, but to me that's a very needed group of activities that are focused on things that clinicians already do. Let's just put mechanisms in place that reward them for doing it and documenting appropriately. So I think that certainly as it relates to part of the continued education, that it's a program that really benefits both the clinicians, benefits the patients, and puts the focus back on what they want to do in the first place, which is advance quality outcomes and match the reimbursement cycle, to that.
And as they look towards the latter half of 2018, I know in October they're actually going to publish the scores for physicians, which will, I think, be another sort of little bit of a seismic change as far as the industry is concerned. What might be one or two things that you tell your clients or you recommend providers do to get the most out of the rest of the year for maximizing reimbursement?
Oh, sure. Great question. I think that part of it has to do with, certainly some of the traditional approach has been to, to collect the data, submit that data to CMS, and then ultimately get some feedback, from CMS. Our preference and solutions like ours and certainly others in the marketplace that are more focused on really being able to give actionable feedback throughout the year, to the clinician practices, whether they're reporting as an individual or reporting as a group, or now with the new virtual group, to be able to understand where they are in and through that process, so they can go back and update the qualifying event, so they can have a better picture, not waiting on feedback from Medicare, but being more proactive and better analysis of their data with consistent feedback that they can adjust real time throughout the year to both maximize not only their reimbursement, but at the end of the day, to just better document the things that they want to desire and do anyway for patients.
That is great advice. And you just touched upon this in just a minute or two ago, which is this recent announcement, ACI becoming PI, which is, of course, that CMS is changing the acronym ACI, which is Advancing Care Information, which under MIPS was the meaningful use part of the MIPS program for eligible providers, to PI, or Promoting Interoperability. I find this fascinating, a fascinating move by CMS, and I really would like to know, in your opinion, what message this sends to the industry? Why this change?
Yeah, I think it's a great message. I think that if I had the opportunity to hear the Secretary of HHS speak at a partner event this past year, and their whole focus around, really shifting the industry to operate or to actually, to move away from all the different standards in the marketplace, and really work collaboratively. I really like the phrase promoting interoperability, because it's a critical component to really help turn all the disparate data systems into usable information. So the fact that, certainly if you think through the transition, meaningful use, when that first came about, there was certainly some confusion in the marketplace. You ask any clinician what meaningful use meant. The typical response was, well, it has something to do with a carrot or a stick, and then at the end, right? Right? So lots of confusion, right? And then even the transition last year into advancing care information, I thought was a good transition, because it put it puts some vernacular around, no, this focus and meaningful use is to literally make sure that you're using information in a way that's advancing care. And so I really like this this continued evolution of meaningful use, advancing care, now to promoting interoperability, because it's a critical and core component that is one of the missing links to really make this successful. We have to be able, irrespective of the source of the data, to be able to have congruency. It goes even back to my early days in health information exchange and community health information network market. You know, we desired interoperability even back 15, 20 years ago. So it's exciting to actually see this come to fruition, and the way that they're doing it in a way that, again, brings the reimbursement model more aligned with what we want to accomplish in the first place, you know, which is delivering higher quality of care, you know, focusing on improving activities, you know, delivering solutions that enable clinicians to benefit from what they wanted to do from day one anyway.
I think also layered on top of that, I think to me, it sends a message to the industry that true interoperability, you know, they make this analogy to the banking system, right? And you're accessing your bank records from multiple different banks. That it sends this message that true interoperability is not a pipe dream, that it actually can be accomplished across the board.
Absolutely. In fact, it puts us really in line with other industries that have already accomplished this, certainly in the banking industry. While the healthcare market has been very, very quick to adopt technology in the actual care, you know, of patients, you know, in healthcare we've been actually slow to adopt technology in the administrative and the financial side of the business. So I think this goes a long way to really bring you know, what has been successful in other markets into the healthcare market, and it's well needed. And I think certainly something that, as you well said, this puts some, you know, some specific emphasis on the fact that not only is this needed, it has been done elsewhere, and we can accomplish this in healthcare.
Yeah, and I think this is also the first time, you know, obviously you know this to be true, and I know this to be true, and a lot of people know this to be true, that interoperability is a portion and a part of MIPS and MACRA and the move to value-based care. But it's the first time that I've actually seen that direct connection. You know, it sometimes they sort of seem like people think interoperability, oh, that's health information exchange and state HIEs and FHIR, and it's, you know, it's protocols and standards. And this to me is the first time that there's been this direct connection made publicly, in my opinion, by CMS that interoperability is also germane to value-based care.
Absolutely, no question about it. And I think that to the extent as well that part of their desire, and certainly some of the confusion even within the MIPS, you know, QPP environment, is this transition likewise to continue to make consumers more aware of what's going on in the marketplace. So not only is MIPS reporting, you know, and effective reporting, you know, tied to positive reimbursement, it's tied now to consumer scores, you know, and to educating, you know, educating, you know, patients on how well their clinicians are stepping into, you know, this particular world. So I think that physician compare website, this move towards really, you know, enabling and engaging, you know, patients is really very soundly measured, you know, not only through this program, but this the overall reality of interoperability, which is absolutely critical and a very important part.
Yeah, I totally agree. As I said earlier, they're going to be posting the first year of scores, I believe, in October, right? They're going to be making those scores public to the general public.
Sure, exactly. Yep.
Yeah. Yeah, so it'd be interesting what happens. If you're just tuning in, you're listening to Interviews Now, and our guest today is Timothy Mills of Alpha 2. So let's switch gears here just a little bit and talk about healthcare reimbursement from, I guess, stepping back or 30,000 feet up. What, in your opinion, is it going to take to make the the process of healthcare reimbursement less complex for the provider, for the payer, for the patient? What will it take as an industry, and how do we ease this process as we go forward?
Sure, great question. And I think that fortunately we've already hit on some of these, but certainly I think if you take a look at really those three Ps, the provider, the payer, the patient, historically they've not been pulling the same direction. And so
Yeah.
I'm encouraged, by an ongoing focus on not only what we've talked about promoting interoperability, but the move now to population health, patient-centered medical home, encouraging those patients, in particular I call them the HONDA patients, which is an acronym for hypertensive, obese, non-compliant, diabetic, asthmatics. That's where we spend about 72% of our healthcare dollars. Getting those patients more directly involved, in their health and their outcomes. I think that's a critical component that benefits not only the provider, but it benefits the payer. Because if the payers can likewise encourage, patients to get involved in their disease state and to become accountable as part of this process, that's a critical component. The other piece that we've already mentioned is there were too many standards. I mean, standards is a ironic term, but that really that lack of interoperability, and again, the historic fee-for-service reimbursement model, which really kind of ended up putting providers and payers at odds with each other. So again, this transition to value, and certainly volume and outcomes measurement, begins to bridge the gap. And because at the end of the day, providers and payers and patients all want the same thing. So thankfully, we're beginning to see both a reimbursement model as well as certain programs like population health, patient-centered medical home, and a variety of others like that really are helping us not only gather this data, turn this data into usable information, better, provide reimbursement to promote those types of activities, okay? The end result is now you can get those three Ps pulling in the same direction. And I think that's a really critical and very important success factor in the ongoing transition of healthcare. It's just got to happen.
Yeah, I think another you're right. All of those things need to happen. I think another interesting component of this, and it's sort of it's a growing conversation, is social determinants in healthcare. That is another piece of the puzzle here.
Sure. Yeah, no doubt about it. I think that certainly as it relates to that, being able to have, more transparency, that social awareness piece, all of those become a very important and critical component in this evolution on the reimbursement and administrative side of a marketplace that has been leading the world in the care of patients. It's time for us to lead the world, on the administrative and the financial outcome side of the marketplace as well.
Yeah, and it's so interesting. For quite a while now, I think about this term value-based care, which we've been living in with an industry now for the last few years. This momentum shift, and I actually had somebody who's not in healthcare. We're having a conversation a couple weeks ago, and they said, "What is value-based care?" And of course, it's a difficult thing to sort of define over drinks and dinner. Do you know what I mean? And not and actually keep the conversation flowing. And I really thought about that, and in my head, in a nutshell, I just was thinking that for me, value-based care sets us up healthcare delivery in a more proactive manner versus reactive manner, meaning fee-for-service, people are sick, they go see a doctor. Value-based care just feels so much more, I don't, empower, I guess, is one word to use, but to me, it's more proactive and not just, I'm sick, I go to the doctor, I get reimbursed.
Absolutely. I mean, you absolutely hit it on the head. If you were looking at a slide presentation that I'll be leading tomorrow, it literally starts out with, we need to be proactive, not reactive. So I applaud you for that. I mean, literally, that's the most important part in this shift. Is what's the old saying? There are two kinds of people: those who make things happen and those who wonder what happened. Right?
Yeah, right.
all too often, I think we've been on the latter part of that as an industry, trying to figure out what happened. Well, we need to be proactive. We need to be, we need to be turning data into actionable information. We need to be, focused on consolidating all of this data and, again, turning it into usable, comprehensive, usable data. That's the difference. And it's about being, proactive, getting in front of those solutions, not waiting for something to happen, and then you respond to it. Even in the aspect of denials management, which is an interesting, scenario. Why wait for a claim to be denied and then go after and chase that revenue, as opposed to being proactive and figuring out ways to get it right the first time, right? Whether it's reimbursement, whether it's clinical practice, let's stop rewarding clinicians for doing multiple engagements, multiple tests. Not that those aren't bad things. We do need to figure out what's right, but let's ensure that we're incentivizing a focus on quality, and so that is just a critical component.
Yeah. I also think sort of layered on top of that, and perhaps making that even more complex than it is sort of the rise of high deductible health plans. And so,
Sure.
The patient financial responsibility has grown tremendously over the last few years, and it impacts the physician practices as more and more companies and individuals move to these high deductible health plans. It's turning
Sure.
the patient into the payer. So where does that fit into this? The greater financial burden on the patient today?
Yeah, very important part. I mean, they literally, as you well said, they're literally becoming the consumer payer. That's been just a growing trend, certainly over the past dozen plus years. And it's actually empowering patients to really become more aware and more accountable. It also fits right in line with this whole push by CMS and HHS on, advancing consumer awareness. We're one of the few industries where you don't have transparency into how well clinicians are providing services. So I think that the fact that the payer industry began by, this move towards higher deductibles, getting them more involved, goes back to the Honda patients we talked about earlier.
Yeah. Mm-hmm.
Let's create mechanisms, to where we can better engage with those better engage with those patients earlier in the process, because now practices are beginning to have to do that because they need to identify, whether or not they have a high deductible plan. They need to be looking at options, for managing credit cards, which they didn't used to have to do, managing billing options, and taking payment plans, and being able to do real time adjudication and get a determination of what that patient's going to actually need to cover the services for that particular day or for that particular series of care. All these things really go to not only empowering those patients, but getting them more involved, not only on the financial piece, but likewise getting them involved in becoming more healthy, so that, again, if they're managing the financial part of that, or certainly a portion of that, they're more likely to be more focused on becoming compliant and getting involved in a wellness program. So I anticipate that this continued consumer choice will evolve not only from patient financial responsibility, but more patient responsibility in their disease state.
Making them more proactive too. So that's the message of today's conversation, I think. So we've got a few minutes left. So before we end our conversation, let's talk a little bit about Alpha 2, what's going on at the company. I've been seeing this phrase. I saw it at Kim's, reimagine reimbursement. I'm seeing it in press releases. Talk a little bit about that and how it relates to Alpha 2 and what's going on.
Sure, absolutely. Well, ironically, you stole part of that with your phrase earlier. I mean, it's literally about...
That was not intentional,
here. Exactly. Oh, so it really is about being proactive versus reactive. I mean, when we're trying to really encourage, the vast majority of our solutions both ClaimStaker, which is our clinical claims and editing solution, as well as our MIPS reimbursement solution. They're primarily, managed through our partner channels, the practice management, EMR, claims clearinghouse, and revenue cycle management companies. But we're trying to get them to really kind of rethink everything around what's historically been a reactive market. So traditional claim scrubbing, traditional ways of reporting. So when we use the word reimagine reimbursement, you'll likely see those the R and the E capitalized, because we want them to rethink everything about how they're doing that. Are they being proactive versus reactive? How do they define things like their first pass claims rate? And how does that relate, for example, if that's a very high percentage, and yet the reality is that 1 in 5 claims are denied and rejected, then maybe I should rethink, how I define my first pass claims rate. If I've got an entire department that's focused on denials management, which frankly we still need and we still want to advocate that, there are great vendors out there that are focused on delivering good denials management solutions, but perhaps in reimagining your reimbursement, it's really about, thinking about a solution that could be more proactive. And what if the best denials management solution was denials prevention, right?
Right.
So we're really focused as an organization on delivering solutions that are very, very proactive. And it's really also about managing the change. You hit it early. The one constant in healthcare is change. So for 30-plus years, Alpha 2 has literally been focused on managing that ever-changing billing and coding rules and regulations, and then creating a very strong, data content with comprehensive edit logic that, again, can be deployed across the entire workflow, not just traditional back-end claim scrubbing, but let's move, for example, let's focus on coding and clinical types of edits earlier in the workflow, at charge capture, at the EMR, right? So we really want to rethink everything around, how you've traditionally gone about both claim scrubbing, clinical and counter editing, as well as, reporting from a value-based perspective. So that's what we mean by reimagine reimbursement, and we're excited, to be working not only with great partners, but really enabling their solutions to be more effective and deliver significant value, to ultimately to their clinicians, both in the ambulatory and the acute care market.
Tim, I just want to thank you so much for your time today. It's been a great conversation.
Yeah, thank you. I really appreciate the opportunity. It's a privilege.
Oh, great. You can learn more about Timothy Mills and his company Alpha 2 at www.alpha, then Roman numeral 2.com. And be sure to follow the company on Twitter at alpha_, then Roman numeral 2. As always, we thank you listeners for tuning in today. For more information about Interviews Now, visit our show's program page on www.healthcarenowradio.com. Until next time, if it's happening in healthcare and it's now, it's on Interviews Now.